Hello everyone, I'm Tamara Green. Thank you for tuning in to Walpole Media's continued coverage of the Walpole Prevention Coalition. Today I'm joined by Kelsey Ober, who recently became the program director of the Drug-Free Communities. In her position, Kelsey works closely with the Walpole Prevention Coalition in overseeing the grant's operation. Thank you for being with us here today, Kelsey.
Thank you for having me.
Absolutely. Can you tell me a little bit about yourself and how you came to this position?
Yeah, so I first got my master's in occupational therapy, and it was during one of those clinical rotations that I was introduced to research, specifically public health research, and I knew that was kind of where I belonged. So I went back to school, and I went to Boston University and I got my master's in public health, where I specialized in epidemiology and biostatistics. During that curriculum, I did a practicum here in Walpole at the Walpole Health Department, and I just fell in love with how passionate and enthusiastic the Walpole Health Department is. And growing up and someone who lives in Walpole, I knew I wanted to come back and be able to serve this community.
That's a wonderful thing to be able to do. Can you tell me how the Drug-Free Community Grant was established and what it does?
Yeah, so the Drug-Free Community Program is a national program. It started in 1997 by the White House, their National Coalition on Drug Prevention, and then the CDC. So today those two organizations co-manage it. So they had the overarching goal to prevent substance use, specifically among youth, but the belief is that it would eventually trickle down into adults as well. But they wanted to do it through community collaboration and coalition building. So today, the Drug-Free Communities Grant operates throughout the country. And then in 2024, the Walpole Health Department applied for it and was awarded it in September. And then we're currently in year one.
Of a how many year grant?
It's a 5-year grant. So every year, whatever coalition has the Drug-Free Community Grant, and there's multiple at one time, you get $125,000 a year to spend on youth substance use prevention, as well as adults. And then you have the option to apply for continued funding for up to 10 years in total.
Great. What do you do in your role as the director?
Yeah, so every day is different, which is really exciting. A lot of it is tied to the grant in making sure that we are hitting our target goals. So that's kind of programmatic oversight, grant funding, such as like budgeting the template, what we're spending the $125,000 on, coalition building, so reaching out to different community partners, such as law enforcement, the public school department, media, kind of making sure everyone's doing their role in that we set aside an action plan of activities we wanted to accomplish within these 5 years, such as building more community programming, increasing education, changing community norms. So it's my job to kind of oversee all of that and make sure we're hitting the milestones, but then we're also reporting to the CDC, making sure this is what we're doing, this is what we have to do.
How long have you been the director?
I was hired in February, so I'm pretty new to the role.
So were you involved in writing and applying for the grant, or were you hired after it was received?
Yeah, so I was an intern here last summer, and Melissa Ranieri, the health director, was kind of in the thick of the application season. It's a big application. So I was hearing about it and hoping that we would get the grant, even though I was not a full-time employee at the time. So I wasn't a part of it. It was after it was awarded, but I know the health department and then a lot of our sector reps. So each DFC requires you to have 12 sector reps, and those are people who represent the community, such as youth, parent organizations, business, law enforcement, school, and media. They were all heavily involved in the process of applying.
Oh, that's fascinating. What is the grant's objective, and how do you collaborate with the Walpole Prevention Coalition?
Yeah, so the DFC program has two main goals, and it's to build up local coalitions through collaboration and capacity building, so essentially building as many people and as many involved stakeholders, so then it's sustainable. And then the second main goal is to prevent and reduce substance use among youth, and then eventually adults. So with the Walpole Prevention Coalition, everything we do is kind of tied in with them, because a lot of them are our sector reps, and then those that aren't are heavily involved in the activities we do, like the school resource officer, the recreation department. Those are all sector reps, but they're also they're people who are actually doing the activities with us.
When you say you work with youth, how early do you start?
So the DFC grant is primarily built for kids in middle school and above. So that's kind of our primary target, especially because we know that's typically when substance use is more likely to start beginning, if it begins that early. But I'm happy and eager to work with elementary school kids as well.
How do you work with them? Can you tell me a little bit about the process of getting them involved? Is it a volunteer type thing on their part?
Yes, so a lot of our youth are volunteers. We have a youth sector rep, and she's just very passionate about substance use prevention, and she willingly signed on to be a sector rep and to represent her youth community. And then we've run focus groups before this grant was established, so those were all volunteer based. So our youth are volunteer based, they're great, and we're always looking for more youth to participate, so anyone can contact me about that.
Over the years, we both know that there have been a lot of workshops and working with young people. What makes this different? Why do you think this is going to succeed?
Yeah, what I personally love about the Drug-Free Community Grant is that it's individualized. So it's based on what the community who has the grant needs. So currently I'm in a 3-week training that's national, and it's communities from all over the country, including the South, the West Coast, and so what their community needs is completely different than what our needs are, but we're both covered under the grant. So I think that's what is really important, and also that it's community-based, so it's actually based on the people who live and work here, so they know what's going to work and what's not going to work. And then the main focus too is also sustainability. So what's going to happen after the grant ends, and that's a big focus. So I think that's what really sets it apart.
Tell me a little bit about some of the events that you hold.
So since we're early, we're first year, a lot of these are future events to hold, but one activity we're planning to hold is a sticker shock campaign. And we're planning to hold that next spring before prom season. So Sticker Shock campaign is where we create stickers that kindly remind adults that alcohol is not for youth, and that we shouldn't be purchasing it for them. So we're hoping to partner with local liquor retailers and put stickers on more of their appealing products for youth, like seltzers, and then just put them on them, and it's a great way to build community relations with the liquor stores, to have them just a nice reminder that, hey, maybe we should be IDing and checking. Another event, less of an event but more of an activity we're doing, is in the fall we're going to be organizing the Metro West Adolescent Health Survey. So the schools will be giving that to students in middle school through high school, and that's a biennial survey that kind of assesses health behaviors, but it also looks at how people, specifically youth, perceive health behaviors from both the standpoint of how they feel if fellow youth do a certain behavior, but also how their parents feel and how they think their friends would feel about them engaging in these behaviors. It's a rigorous survey, it's very valid, and it tells us a lot, especially because it compares our town to other Metro West regions, so it's an interesting way to look, like where are we doing well and where could we improve. And then we're also planning to hold a social norms campaign. And so a social norm is just essentially a common belief people have about things that are happening in our society. So for substance use prevention, a common belief is that you think everyone is using, which we know that's actually not the case. And in fact, most kids are not using. So it's kind of about really pushing that, what's actually happening, and pushing that narrative. So those are some of our big ones.
How do you know that most kids aren't typically using?
Yeah, so a lot of that comes from our Metro West survey. but it also comes from the youth themselves. We've done focus groups, we've done informant interviews, and talking about, we make them open spaces where the youth, it's not about getting in trouble, it's not about, being your perfect self, it's just sharing, what is actually happening, what do you see? And then we also talk with other community members such as law enforcement, school resource officer, parents, recreation department, and kind of ask what they're seeing.
What other town entities are involved in the Prevention Coalition?
Walpole is very special in that people really want to be involved and help. So we have so many sectors involved. So we have law enforcement, and they're very supportive and they're very evidence-based, which I appreciate, in that they want to do what works. Walpole Public Schools are a huge supporter, helping us with do the survey, get into the schools, talk about the health curriculum. Walpole Media today letting me come in and talk. We also have the recreation department who are working on hosting different programming for youth. The Walpole Public Library. Walpole also falls under another grant, Mass Call 3 Prevention Partners, which is also a substance prevention grant. So there's 2 co-coordinators who do our region who are also actively involved and help me and help the Walpole Health Department run certain campaigns. They were the ones who conducted the focus groups before I was hired. So those are the big entities.
I know you're relatively new and the program is just in its first year, but do you have any timelines and metrics that you need to meet?
Yes, so for the DFC grant, there's a couple of rotating deadlines. So every March, so when I just started, we had something called an annual progress report that was due. So essentially that means we had to update our action plan. So our action plan is essentially just the roadmap, what we're gonna do, what steps, and kind of when we wanna do them. So I had to update that for the 2025-2026 year. And then I also had to update our budget, so what we anticipate on spending and how we anticipate spending it for the next year as well. Every August we have a progress report due, and that's just kind of, again, sharing what we've done, how successful we felt it was, and then what kind of objectives it hit on our original action plan. So those are the 2 big ones. Once we hit year 5, we'll also have more reporting requirements for that as well. And then finally the survey, we update the survey every time we hold one, just with the updated questions, so then they know what we're asking. So we have a few questions that we have to ask.
How many surveys do you typically hold?
Usually, so we're just doing the Metro West survey. We also are planning to do a parent caregiver survey in the off years that we're not holding the Metro West.
Why is the Community Coalition an effective way to try and prevent substance abuse amongst the youth?
Yeah, community coalitions are great because they're the community. They know what they're seeing. They live it every day. They also know the people. They know what things are going to be effective, what things they've tried in the past, and what things they haven't tried but might be effective. I also think no one cares more about themselves than the people themselves. So having people who are made in the community, I think, is a really effective way to get it.
What is the coalition currently working on?
So currently, we just finished creating our website. So yesterday, we officially launched our Walpole Prevention Coalition website. So that has all sorts of resources for youth, adults, parents, caregivers. It also has educational materials, updated events. It'll have our quarterly newsletter. So that we're really excited about launching that. We're also gearing up to start getting ready for the Metro West, because that'll be done in the fall, and there's a lot of behind the scenes work that goes into running that as well.
What are some of your personal and professional goals as the director?
So for my professional goals, I just want to do the best job that I can. I want to be able to help people. I'm hoping that if there's someone out there who needs some assistance with substance use, that something we've done can help them. I'm hoping we reduce our substance use numbers. I also just really hope we kind of change the mindset about substance use. even from using or also just from being safe and healthy behaviors.
Okay, that's wonderful. What kind of research is currently taking place in the community, and what kind of data are you finding?
So a lot of our data, again, is from those focus groups, key informant interviews. Those are with head stakeholders, such as like the chief of police. And then also Metro West and the parent surveys as well. We're finding that, fortunately, substance use isn't as high as we would fear. Youth are not using substances in excessive amounts overall. We're also finding that I think one of our biggest barriers is parent perceptions and perceptions of use and the harms of use. So I think a lot of it is social and community norms is what we're really trying to address.
What role have the students played in the coalition?
So the students have been helpful in gaining more information from youth perspectives themselves. Like I said, we have a nice youth sector rep, and she's always happy and is available to help and kind of give her impact and be able to represent the youth community. But the students are also, they're giving us our data through the surveys, through the focus groups, but they're also telling like what's working and what isn't, like what recreational programs, either from the recreation department or the schools themselves, what's attracting them, what are the things that they like, and that will make a positive influence on their life.
I would imagine one of the biggest obstacles is gaining the trust of the students, so what are you doing to combat that?
Yeah. So I haven't worked with any of the youth yet, but my hope is to be able to just kind of approach them from my standpoint. I'm older, but I'm not that much older, so hopefully we can just be honest with each other and know that I'm here to just help and support. I'm not here to do anything, get anyone in trouble. I'm here to just be able to help teach them and promote behaviors that will keep them healthy, because that's what I want. We have the same goal.
Excellent. What are some of the risks associated with underage drug and alcohol abuse?
Yeah, so some of the risks are, a lot of it is brain development. Like we know that both marijuana and alcohol actually have serious consequences on the brain, specifically with cognition and memory, because it really is true that the brain is still growing until your mid to late 20s. It also can stunt your bone growth, your development. We also know from a behavioral standpoint that youth make riskier decisions, and some of them are great, like some of them, taking that trip or, trying out for a sports team or doing a play. But they also, on the flip side, is that they make them more susceptible to poor risky decisions, and that's always compounded by substance use, such as drunk driving or driving under the influence, or going with people who might not have your best interests in mind. So it's really important to understand that you may think you're smart, and you are smart, but there's still parts of your brain that need to really develop so you can make those choices with substances, because substances add another layer.
I would imagine that peer influence has a lot to do with if a youth does or does not try substances.
Yes, yeah. We know that peer as well as family involvement is very critical in most people, youth included, their decision to use or not use substances. So that's a big part of what we're trying to work with, is making sure peer and family engagement is positive and is about open honesty and communication and just talking through decisions and making the best choices for yourself and your body.
Okay. What are protective factors, and how will they be implemented in Walpole?
So protective factors are any factors that really protect you and that are personal to you, and whether to engage or not engage in a certain behavior. So some protective factors include parental engagement. It's also really important for parents and guardians to set clear expectations of what they think is appropriate regarding substance use. You might think that your youth knows, they know that I don't want them to use, but they might not know that. So being clear about that is something that's big. Having school and community and connectedness is huge, making sure you feel a part of to whatever community you want to belong to. It doesn't have to necessarily be Walpole, it can be the sports community or the theater community, but having something that you feel like you belong in is huge. Parental monitoring, so just making sure you know what your kids are doing, and just, who they're hanging out with, the activities they're involved with. Just monitoring. Also having a stable home life is also very important, and including being able to be open and honest with your parents and guardians about what you're feeling and experiencing. Mental health support is obviously also a huge part of it, making sure you have the resources you need to take care of yourself. And then just, again, overall connectedness. I think we undervalue how important that is at times. So for Walpole Prevention Coalition, the DFC grant, we're really honing in on those protective factors and making sure that we're really approaching those as our main goal, because those are what's going to be more sustainable.
We are nearing the end of the school year, and I know this is a new job to you, but over the summer, a lot of students won't have that feeling of connectedness. So what are your plans for the summer, and what can youth do to try and find that connectedness, that community?
So for this summer, we have a lot of programming through the recreation department. Junior Police Academy is a huge summer program, and that's something that eventually the Walpole Prevention Coalition in my role will be more involved with. But I think the rec department as well as the police department do a fantastic job already organizing it. And that's a really great way to learn more and to work on your physical fitness as well as your mental fitness and learning about how laws and regulations work. And we've seen a lot of success with that. There's also a lot of other recreational programming and camp through Walpole and the public schools. But for those who may not be involved in that, I'd say my best opinion for people is to find what they like. It doesn't have to be big scale, it can be small scale. Find some kind of hobby that you enjoy or a friend that you can hang out with, or even your family. So I think just finding something that brings you joy and fills you up is a great way to stay connected.
Wonderful advice. Tell me about the My Why and Talk They Hear You program.
So those are two campaigns. The My Why and the Talk They Hear You are two different campaigns that we've previously implemented and that we're currently implemented. So the My Why last spring, our partners at Mass Call 3 Prevention Partners kind of approached several high school students at Walpole High School, as well as their 3 other communities involved with, and asked them, what makes you not use substance use? What's your reason? So they recruited students to kind of give that answer. They wrote it down on a piece of paper, and they ended up filming each student holding their My Why. And it was really nice to see everyone's different reasons because they're all personal and individual. So we're hoping to run that again in the following school year. And then Talk They Hear You is a national campaign from SAMHSA, which is a government organization. And it's essentially providing caregivers, parents, community members, and school professionals with the resources to have open and effective conversations with youth regarding substance use. And it kind of prioritizes the importance of just having those conversations and coming in with a non-judgmental and open mindset to hearing what your youth are saying and what you want to say to them. So it's kind of just about giving tips and talking about why it's important.
And that's not just for parents, that's for anyone, correct?
It's for everyone. So we're hoping part of our goal is to be able to just overall improve adult and youth relationships in the community, and that can be with parents, caregivers, older siblings, teachers. So Talk They Hear You is for any adult and who has a youth relationship in their life.
Okay. What are you most looking forward to at this point in the program?
I'm personally looking forward to actually getting to start working with the youth and coming up with some more programming. I'm really excited to see and run more focus groups and learn what this newer batch of youth are saying. I love learning about the whys of everything and learning more about people. especially as someone who loves data. I think to me that's always really interesting. So I'm personally excited for that. In the program itself, I'm really excited to see some real changes. I'm excited to see more involvement with youth in the community and in the coalition, and then I'm excited to have these programs up and running and see them become like their own life.
How can someone get in touch with you? Where are you located? And is there a phone number or an email address you can share?
Yes, yeah. So I'm located in the health department. I'm there Monday through Friday, and I follow regular town hall hours, so you can always find me there. You can also reach me. I have an email. My email is kober, so KOBER, at walpole-ma.gov. You can reach me there anytime. You can also reach out to us through our website, the walpolepreventioncoalition.com. We're always looking and welcoming new members, youth and adults. If you're interested, come to a meeting. It's low commitment. It's a great group of individuals, and we would love to have you.
How often are the meetings held?
Meetings are held once a month. They're the third Tuesday of the month. And they're at 6:30 p.m. They're currently on Zoom, so they're very accessible.
Great. This has been fascinating. I myself have learned a lot, so I'm assuming our viewers also feel the same way. Thank you for joining us.
Thank you.
And I'd like to thank all of you for joining us today. We hope to see you at our next interview with local peer recovery coach Johnny Pike. For Walpole Media, I'm Tamara Green.